Hey, hi.
Productive, but also,
Oh, hello.
Hello.
what's up? It's working.
I know. It's so nice to see you.
Ugh, I feel like it's been a really long time. Like at least
Because
a
it
month,
has.
actually. Yeah, it's
Yeah.
so weird. Oh my gosh.
How are you holding up? How are you
Not.
feeling?
Um, I'm doing pretty well. I'm learning to utilize my time wisely. Like the first week of quarantine was like me watching a lot of TV and sitting around. And
Yeah.
now I'm like, okay, what are things that you actually want to like do with your time versus just
Mhm.
kind of sitting and waiting for this all to be over. So it's definitely transitioned over the last couple weeks to more productive, but also just enjoying the time.
Yeah. I feel like it changed a lot in the last week. Like, I feel like for the first week or so, everyone was in this space where they
Uh-oh, it's
just
frozen.
were like, it's a vacation. Oh, you're unfrozen now. Can you see it?
Okay, cool. I can hear you. Yeah.
Yeah, I felt like initially people were like, "Oh, it's a vacation. I'm gonna, like just binge watch Netflix and eat unhealthy food." And then suddenly it was like, "Oh no, we need to actually function in this new space. So what is that gonna look like?"
Right,
So
right.
it's the adjustment
Yeah.
of that. But you're doing virtual sessions, right?
Yeah, so our clinic, ever since we closed, we're doing basically like complimentary virtual sessions with our current clients. So it's just a way to, you know, kind of connect with them, touch base. A lot of people have been having like complaints of back pain, neck pain, and I think it has to do with the amount of time now that people are spending at home versus
Yeah.
up and moving around. So I've definitely had a ton of back pain complaints. So really working with my clients on, okay, how can you mobilize and relieve pain on your own without me hands on? So that's
Yeah.
been challenging.
I bet that's challenging because I mean, I've seen you. I know you're a really hands-on practitioner. So, and I
Yeah,
get it. That's how I am too. Like, as an acupuncturist, I'm like, well, I want to needle you. So,
I know, I know. It makes you really just realize how great it is to be able to use these and touch people.
exactly. No, but I think the posture and the sitting at the computer, like, I don't usually suffer from neck and upper back stuff unless it's like I just overdid it in a workout. It's rare
Right,
for me to get like slumped posture or to feel like, oh, this is gross, like I need to stretch. And I feel like I'm constantly feeling that now. And it's definitely due to people being home and being on the computer more, being on the phone more.
yeah.
Um, I'm just kind of having a hard time adjusting to that because I am still like working out. I'm doing body weight stuff. I have some kettlebell stuff here. But it's like you can't make up for the fact that you are physically sitting more and our
Yeah,
bodies were not made to sit on this hard bench that I've been sitting on most of the day and
right,
working on. So,
right.
uh,
Yeah, I mean, I think, I mean, some of the advice I've been giving clients is, I mean, the very obvious thing is obviously to get up and move. Everyone already knows that. So what I've been doing is kind of like taking my clients through little mobility exercises, especially for the upper back and the neck area, just kind of like helping lubricate and mobilize the joints, versus just like trying to hold certain stretches. Is all about actually like moving through certain ranges of motion. So that's definitely something I can share and show a little bit with you too.
yeah, that's kind of what I wanted to ask about because I think like there's also this idea of like, oh, I'm stuck, so then I need to stretch. But if you're just stretching and holding another position, is that really the biggest bang for your buck right now? Or is it, like you said, more about mobilizing, lubricating, getting
Yeah.
blood flow going? I think that's really important because the way we're conditioned to doing things, or even how, we may have liked to do things in the past, is a little bit different now. And there needs to be some type of adjustment and just intention behind like the movement we are having.
Right, right. Yeah, I agree. Um, well, should I like show a few of
Yeah,
the
I'd love to just like share some really basic stuff that you would recommend for the
Okay.
general person that
Yeah.
is having a hard time right now being like hunched on the computer.
Okay,
So,
I'll show my few favorite mobility exercises. Sorry, my throat is like don't worry guys, I do not have COVID.
you
Okay.
can't do that in public now. So,
I would say, well, I'm just gonna, oh my gosh, Chase, be quiet. I'm
I,
gonna start with my first favorite movement. I'm trying to find a place to put the camera where I can actually kind of step back and you can see me. Okay, can you see me right here?
yeah, Kasim, is that a goat?
Oh my gosh.
Miss you
Okay,
too. All right.
so the first thing I like to do when I'm trying to just kind of like get things moving, say I've been sitting for a long period of time, is a little bit of just thoracic flexion extension, but I'll add some rotation with the arms. So basically I'm
Okay.
going to internally rotate my arms and kind of round everything forward. And then you're slowly going to open up, bringing the sternum up towards the ceiling. So I do that a few times, and you
I
kind of
like
want to feel like you're hugging a beach ball when you round down, and then just slowly coming up.
that.
So you
Okay.
kind of just go in and out of that motion. So with that one, I usually do, I don't know, like 5 or 6 times. And really with any of these, for any of you watching, you don't want to push any of these. You should just go with what feels good for your body. So if it feels like, ugh, like this is too painful or too much, then you just have to back off a little bit. And eventually it gets a little bit easier as you start to move. So that's the first one I would say that I really like. The second one is
Someone
just really,
asked Kayla, is it similar to cat camel?
it's kind of similar, but you're adding the component of internal rotation with the shoulders
Okay.
and then external rotation. So you're really getting opening through the entire anterior line and then the entire posterior line versus a cat cow, you're really just kind of focusing on thoracic and lumbar flexion extension. So this kind of gets everything moving. Um,
Okay.
yeah, and I mean, the reason this type of exercise is helpful is because a lot of people, when they're sitting at their desk for a long period of time, they try to like readjust by kind of like shoving their shoulders back and like really doing this and like trying to sit
Yeah.
up, right? But actually, like when you try to like overcorrect your posture, you create more areas of tension and more issues. So
Yeah.
don't, rather than trying to like, pick a posture or put yourself in place, just mobilize and then your body will naturally now have more space to sit in a better position. If
It's
that
like the
makes
body
sense.
knows what it wants. So if
Yes,
you're giving it the proper nourishment, which is circulation, which is, those fluids going to the muscles, is helpful.
right.
I know when I tore my rotator cuff and I had all this like upper back and neck stuff as a result, I overcorrected my posture and it was exactly like you just demonstrated. Like this, just like, I'm going to force myself into this.
Yeah,
And now I have difficulty with that, like thoracic flexion because so
because you're like
it is,
overextended all the time, huh?
yeah.
Yeah, I have a
So,
lot of
and then
people
my
that,
shoulders roll forward, as you know, having worked with me. So I think
yeah,
that's a good one that you just demonstrated just to get things moving properly.
yeah, it just generally starts to open things up. And then usually after I've done that one, what I'll do is just like a really I call it a controlled articular rotation, but of the entire spine. So what I'll do, I can't see what anyone's saying, so hopefully you can see me.
That's okay. I'm watching it.
Okay, good. I'll cross my hands here, and then I'll slowly just round down one segment at a time. And you want to keep your hips stable. Once you get to the end range, you're going to start sweeping all the way around, kind of drawing a circle on the ceiling, going into extension and lengthening through the spine, sweeping all the way back to the left, and then rounding all the way down, and then you'll do the same thing other direction. So with those, I'll usually do like a few each way, and same thing, you want to take your time and you want to listen to your body. So maybe your circle when you start is really small, and then as that gets more fluid, it gets bigger and bigger. That's a really, really good way to kind of get the spine moving, and decrease some of that stiffness just from being in a position for a prolonged period.
What about breathing during that? Is there, like a specific point that you recommend, or is it just kind of like listening to your body?
It's a little bit of both. I'd say the breathing, definitely want to listen to your body, but really focusing on kind of exhaling slowly through the movement, especially when you get to more sticky areas, kind of just like really slow, controlled breaths. It really does help calm down the system, and you want to actually get some good expansion of the rib cage when you're inhaling. And then as you exhale, that should just be a really relaxed movement. So it shouldn't feel super forced. Yeah.
Yeah,
So
I could
those,
hear your breathing, but I didn't know if that was what you would recommend for people or if there was just like
yeah, it's so funny because I don't even notice when I breathe through my like stretches and exercise. It's just become such a habit.
Yeah.
Um, so, so those, for those of you that just joined, you can always go back and look. So the first two exercises that I gave were internal rotation, external rotation of the shoulders with that sternum flexion extension, just to kind of open up the spine. And then the second one was a controlled articular rotation of the spine, obviously not that fast, really taking your time. The third one that I really like, you can use a chair or like a coffee table. I'll use a coffee table. I just have to prop you guys up somehow here. This is so funny. Okay.
I know. I mean, this is legit Instagram Live right now. It's just like,
I know. Okay, can you guys see me? Kind of?
yes, kind
Okay.
of. Yeah, that's good.
Yeah. So this is a coffee table. Something that you can do is, and you can use a couch, whatever, is place your elbows here and then just kind of drop down, sinking the head through and getting that extension through the thoracic spine. So the elbows come up, the head and the sternum drop through towards the floor, and just kind of going in and out of that. This one feels really, really, really good.
That's like Derek's favorite.
Yeah, that one's really nice. And, you know, those first three, those are all addressing more like the upper body and neck. The back is definitely something that you, like everyone should really, I think, take note of, but also remember that just because, say your back is really stiff, just because it's having pain, it doesn't always mean that that's the issue. Oftentimes it's the hips that are actually contributing to a lot of that low back pain and stiffness. So I've noticed that too with clients. They're like, well, I keep stretching through here, and I shoved a foam roll and a lacrosse ball in my low back. But the issue is you can release that all day, but if your thoracic spine above and your hips that are below are tight, it's not going to help to just continue doing these low back stretches. It could actually irritate this, you know, the issue further.
Yeah, and everything gets in the hips very tight with sitting.
Oh yeah, totally.
Like,
Yeah. How are your hips doing with all this?
actually, my hips have been good, but I've been working very hard with workouts and hips lately too. So
Yeah.
I think Yeah, I think it's more just like being really conscious of getting up and moving. When my hip pain started initially years ago, it was when I was studying for board exams. And it's because I
Okay.
was sitting and the way I would sit was irritating one of my hips. So I'm very conscious of that now, but it's literally like getting up and constantly moving and knowing that I need to do that.
Yeah.
Someone asked any recommendation to help with hip flexor or maybe psoas pain, which definitely is an issue with lots of sitting.
Yeah, a stretch that I really like for the psoas slash hip flexor is actually really common. So I'm sure a lot of you have seen this one, but I like to do. Can you see my like waist down?
Yes.
Okay. Can you? Am I too far though?
No, I think you're okay.
Okay.
I can still
Sorry
see
if
your
you guys
waist.
can't see me. Okay, I like to do like a really basic mobility in and out of the half kneeling position. But the key here is you have to be engaging lightly the back glutes. So whatever hip you're stretching, making sure that you're kind of squeezing that right glute to get into that stretch further. Now, if you want to make it more intense, you drive your hip forward and then you're going to reach that hand down and the opposite hand up and over, and you're going to feel this really good stretch coming up and then towards the side. Because remember, your hip flexor, not only does it attach to your leg, but it attaches to your lumbar spine. So people kind of often forget that the hip flexor actually is um, attached to the low back. So this is
Yeah.
one I like. And then what you can do is kind of open up that knee some more. And now you're going to feel it closer towards the inner thigh and groin. Ooh, okay, that one's really intense. And then go through that again. But what you'll notice is I'm always giving dynamic stretches. Not that static is bad. I like static stretching too, but the dynamic is really nice to start because it gets the blood flowing and it gets the tissues warm. If you go straight into static long holds, your tissues might not be ready for that. So I would say go through some of the dynamic movements. And then if you're like, you know what, I really want to work on opening up my hips or opening up whatever, my pecs, then go for those really long hold stretches. And I'm talking like not just 30 seconds, like hold that stretch 1 to 2 minutes. That's when you're really going to feel change in the tissue. Just even research shows that like there isn't actual cellular change until about that 2 minute mark if you're really looking to create true length in the tissue.
Yeah. And I think it, like you spoke to, matters like what is your intention in what you're doing. Like if you've been sitting all day, there's no reason to then immediately go into a static stretch. Like to do more
Right.
dynamic stretching and get the blood flow going is gonna
Yeah.
give you a lot, like a bigger bang for your buck.
Yeah.
And like I always like set a static stretching after a workout. Like that's when I feel like my tissues can handle it. That's when I feel like I get, the biggest benefit from it.
Yeah.
But yeah, if you've been like sitting and you've already been in a static position, like get up and
Yeah. It's
move.
like get up, move, like go walk, maybe do some like, I don't know, like shake it out. Like it doesn't have to be so like structured all the time. Then go into some dynamic mobility. And then if you're feeling really crazy, go into that static long hold breathing. Yeah, I agree with that. You definitely want to be a little bit warmed up before you just dive right into like holding a stretch.
Yeah.
Oh man.
And then I guess lastly, do you have like a recommendation as far as like how often you think people should be doing this? Like, is it based on how much they're sitting? Sometimes if people are like at a job in the past, I've told patients like, no, you need to set an alarm and get up and move.
Yeah,
But is it very relative to how much sitting you're doing? What's the best way to kind of gauge that?
I would say, I mean, to be honest, you can never do too much unless you're like actually forcing yourself into positions that don't feel good. I would say sprinkle them. I call them like little movement snacks all throughout your day. I don't even notice when I'm doing them. Like, say I'm typing, right? Like this. And I'll just suddenly, like, if anything starts to feel really rigid, I'll start doing like some of my thoracic extension flexion. I'll start doing some controlled motion with my head. I'll be in a seated position and start. So like it's become very habitual for me, just because it's kind of, you like that, Myra? It's just a habit of mine, especially because my job when I'm not in quarantine is very much movement based. Like I'm always moving, I'm always standing. So now that I'm kind of forced to be interacting with people on the computer more, I still feel that like urge to move around. And so
Absolutely.
I guess, yeah, the answer is like the more the better. The more you can get up, move around, shake things out, like literally shake. Like it will really benefit your body to start jumping up and down, whatever you need to do. I know it sounds crazy, but you're going to feel so much, more energized, but you're going to start feeling, okay, blood's flowing again. I'm not starting to feel like, oh, everything's just closing up. Yeah. So
And blood
that's a
flow
really
is
good question.
underrated. Like, you need blood flow for your brain. If you're sitting at the
Yeah.
computer all day, like, you are not using your brain to the fullest potential unless you're doing these movement snacks, which is my favorite term of our talk right now.
Oh my gosh. Actually, I stole it from one of our therapists in Toronto, Kevin. I think that's who started it. He calls them movement snacks, and I totally stole it. I was like, that's good. I like that.
No,
But yeah,
movement snacks are perfect.
yeah, it's helpful. I mean, I know everyone, it's very common sense, I think, for the most part, like, oh yeah, we should get up and move. But, even like taking it back a step and realizing like it doesn't even have to be timed up. As soon as you start feeling like your body is starting to guard or get rigid, or you start to feel discomfort, that's your big alarm to get up and do something, shake it out, move around, do
It's
your
also
movement
another
routine.
opportunity to like start paying attention to your body
Yeah.
because we all have that where we notice like, oh, I'm sitting and now I'm shifting a little bit. Well, that's a sign that your body was
Oh yeah.
uncomfortable being very stationary and you should probably move a little. So
Yeah, that
listen to that
fidgeting
little
for
hint.
sure. I agree. And then, place your computer up somewhere where you can stand and move around freely. Like you don't always need to be sitting, as nice and relaxing as that sounds. Like when you're in this position on your couch, you're like, I know we're all doing it right now. I was doing it I was doing